Good morning. I'm Kaye Bender. I'm the President and CEO of the Public Health Accreditation Board. We accredit governmental public health departments across the country. We just recently launched an additional program for Army Preventive Medicine public health units, as well as statewide vital records health statistics accreditation. We're not as old as CEF. We're actually coming up on 11 years, so we've learned a lot from our accrediting colleagues. Our public health department accreditation standards, when we developed them in order to get them up and running, we selected the 10 essential services of public health framework because that was the framework that was the most familiar to most health departments. And so we have 12 domains, 10 of which are related directly to the 10 essential public health services. Excuse me. And then we added one for management administration and one for the governance component. What I'm going to talk to you about today, though, is only the piece that speaks about workforce development and what we've learned so far. There are a few assumptions that we made as our workforce standards were being put into place. And so I want to let you know these because certainly some things have changed since then. I'll talk about that briefly in a second. The first assumption at that time was we needed less than 10% of the graduates of MPH programs, this was prior to the BS programs, would go into governmental public health work. The second was that, related to that, is therefore most of the public health workforce is not formally educated in public health. Third is that merit systems in the government are probably the biggest obstacle to any kind of innovation or change related to what public health departments might want to do regarding their workforce. And four, at that time, there was no PHWN, so there was no standardized needs assessment approach across the country. We have two overarching standards in our Domain 8 related to workforce. One of those is the recognition about the less than 10%. And so it's encouraged the development of a sufficient number of qualified public health workers. And so in that particular standard, what we ask health departments to do is to demonstrate how they partner with their academic institutions in order to give those students access to public health experiences to promote the development of future public health workers. Overall, our health departments do well with those, as you can well imagine. Those who don't do well are typically those who don't have schools or programs that teach any public health content, including schools of nursing in their immediate geographic area. Our second standard bucket relates to ensuring the competent workforce through the assessment of staff competencies, provision of individual training and professional development, and the provision of a supportive work environment. Within that are all kinds of requirements. The overarching one, of course, is the development of workforce development plan. And I'd be remiss not to acknowledge my colleagues in the audience from ASTO, NACHO, Public Health Foundation, and others who have assisted health departments in what has been, for the last 10 years, a really new activity for them to actually assess the needs of the workforce and develop a plan to address those needs. Now, since the PHWNs has come about, we accept PHWNs as that assessment. So I rarely publicly agree with Brian Castrucci. Sorry, Brian, I couldn't help that. But in this particular case, I agree. There's no point to continue to assess, right? I mean, we've got the data. Let's move on with that. But I will say that overall, our health departments who go through accreditation struggle they struggle with, now that they've learned from Ron Bialik and from Peter Holgrave and from Mike Fraser's group and others about how to develop a workforce development plan, and now that they have the PH-WINS data to inform that plan, they struggle with the implementation. And we also have measures in that same bucket that speaks to a supportive work environment. So, Brian, I do think we could learn more from this last PH-WINS data collection. So let me, I want to close by saying health departments have come a long way in the last several years in terms of paying attention to the workforce. But I do also agree with both first speakers. We have a lot of work to do yet. The good news is I think we have a lot more information upon which to base that work, which I'm encouraged about. My last comment, the Public Health Accreditation Board is in the process now of refreshing our standards and measures and the whole area of the workforce development. Now that some things have changed in the availability of data and other skills and resources that are available through TRAIN and through other opportunities, we'll be able to update those. So I too will be glad to answer any questions at the appropriate time. Thank you.